So thank you for giving me a chance to talk about some of the work we're doing at the National Child Mortality Database, the NCMD, on childhood deaths, modifiable factors, and measures of deprivation. So the NCMD was commissioned by HQIP on behalf of NHS England. We started collecting data on the 1st of April 2019, and we collect data on all children who die in England. It's led by the University of Bristol in collaboration with these partners that you see up there, but in particular I want to draw your attention to the Lullaby Trust, SANS and Child Bereavement UK, who are our partner charities. And as most of you will be aware, it's a legal requirement to notify the deaths of any child that dies in England to the NCMD within 48 hours of it occurring. But after that, the child death overview panels are tasked with reviewing those deaths and anyone living in their area, and that's a comprehensive multi-agency sort of information gathering process. All that information is collected on statutory and standardised forms. But it also includes a lot of factors like the contributory and modifiable factors around the death, and also potentially the views of the family. Now, this has already been referenced by Simon earlier. This is the Child Mortality and Social Deprivation Thematic Report, and this work today is an extension of that. This was published last year, and the aim of this work really is to identify the patterns of social deprivation and child mortality, and where those potential points of intervention and health policy might well best be targeted. So our measure of deprivation we've used is the Index of Multiple Deprivation. That's the IMD of England 2019. That's produced by the Office of National Statistics, and it's derived on a resolution of the lower layer super output area, or the LSOA. Now there are 33,000 of those across England, and each one has a population of about 1 to 3,000. So the risk of death is derived using a Poisson distribution and regression model, and we've calculated the relative risk of death for each increasing deprivation decile. Now in this work, a higher deprivation decile indicates a higher level of deprivation in the area that the child is normally resident. So between April 2019 and March 2020, there were 2,688 deaths reviewed by CDOPS in England. And this graph shows the age and sex distribution. And as you can see here, most deaths are under 1 year of age. And in fact, for most ages, there were slightly more boys than girls that are dying. And this graph shows, on the left, the less deprived areas of England, on the right, the more deprived areas of England, and the bars show the number of deaths occurring in each of those areas of deprivation, or each of those deciles. And as you can see, it goes up as deprivation increases. That black line represents what we really should see if everything was equal. And this profile was seen across nearly every category of death that we record: medical and surgical, congenital anomalies, trauma and suicide, SUDICs, as well as perinatal and neonatal events. However, interestingly, as already mentioned, we didn't see this with malignancy. We saw no association in any of the analyses between the risk of dying of malignancy and deprivation. However, when we do calculate the adjusted risk of dying, this is per 100,000 person years, and it's adjusted for the underlying population structures, you see the same association. As deprivation increases as you move towards the right of the graph, so does your risk of dying. And in fact, there's about a 9% or a relative risk of 1.09 for each and every increase in that deprivation decile. So if you took the risks that are exposed to the less deprived half of our population and you gave them to the population of the more deprived half, indeed across the whole population, we estimate you'd see 21.2% less deaths every year in England. Now, in context, that's 732 less child deaths every year. That's 28 primary school classes every year. That's 2 complete primary schools every year of children who wouldn't die if the children in the more deprived half of our population had the same risk as those in the less deprived half. And actually, this was ubiquitous across the population. It wasn't affected by the sex of the child, the rural or urban nature of where they lived, the region of England. In fact, the only thing that did seem to be associated was the age, and that was only in that those children in the middle group, the smallest group in fact, between 5 to 9 years, didn't appear to have much of a strong association. When you look at the sub-deciles of deprivation, these are the things that create the index, wider barriers to housing, now that is the cost of housing as well, employment and adult education, and the quality of housing where the child lived were the strongest associates with risk of death. Interestingly, health and access to services were not strongly associated. And lastly, when you look at modifiable factors, now these are things identified by the CDOPS at review that contribute to the death and could be modified to reduce death in the future. The number of deaths with modifiable factors, again, goes up as the levels of deprivation increase, and that seems to be for most of the causes of death. And in fact, the relationship between modifiable factors and deprivation appears to be different. The blue line here shows the relative risk increasing as deprivation increases for children with modifiable factors at their death. The orange line shows those children who didn't have modifiable factors at their death. And there does appear to be a different relationship with the measures of deprivation. So overall, there's a clear association between the risk of death and the level of deprivation, and that's for everything, perhaps not for malignancy though. And overall, there's a 10% increase in the risk of death for each and every increasing decile of deprivation across our population. 1 in 5 child deaths could be avoided if children living in the more deprived half of our population had the same mortality as those living in the less deprived half. And children living in more deprived areas appear to have a higher proportion of avoidable deaths, as measured by these modifiable factors at review. The association is everywhere. It's in all our demographics, all our communities, but it is more noticeable in the youngest and in the oldest children. And adult employment and education in the area where the children live, and interestingly, the quality and the costing of housing may well be the most efficient places to target our future resources. I'd like to thank all of our partners for helping us with this and the wider portfolio of work that we do. If you're interested, you could follow us on Twitter at @NCMD_England. Please come and look at our website, and you can always sign up to our newsletter there as well if you'd like. And thank you all for listening.